Wubba-lubba-dub-dub, we are back. This is part... Oh crap, I can't even remember what part this is. I think it's part 4? No. 3? Wait. 4. Yeah! I'm gonna stick with 4 for now. If it's not, I'm sorry. If you haven't watched any of the other previous videos, check that out, because we're talking all about therapies and treatments. If you're using the OpenStax book, that's chapter 16. So let's move on. We just talked about humanistic therapy. Now we're talking about behavior therapy, also known as behavioral therapy. When you think of behaviorism, you should think of conditioning. And when you think of conditioning, you should think of that fancy word known as training. Yeah, damn it, look, this bottom thing's back. It was gone for a couple videos. It just randomly chooses when it's going to be back. Look at this thing. Anyway, so let's talk about John B. Watson. Let's talk about B.F. Skinner. But more importantly, let's talk about the application of their behaviorism in the therapeutic setting, because you're going to train that pain away. So I'm going to show you some very simple behavioral therapies. So step 1, behavioral therapy is all about conditioning. So make sure you have what is normal and abnormal behavior. You want to train away the abnormal and make something normal. Now that's a term we classically don't use. We don't like to say abnormal and normal. What we want to say is more like dysfunctional and functional. Dysfunctional meaning that it's impairing your ability to function, and functional meaning you totally can function. But behavioral therapy uses principles of classical conditioning and operant conditioning. So the behavioral change doesn't require insight. You're not sitting down and asking them to tell me about your mother, tell me about your dreams. We're also not giving them hugs necessarily. We're doing very specific techniques, these behavioral techniques. This is why it's called behavior modification. If you've ever seen the movie A Clockwork Orange, some people argue Stanley Kubrick's classic. Some people say Full Metal Jacket. Some people say A Clockwork Orange. Anyway, considered a classic movie, but A Clockwork Orange is all about behavior modification. We're going to talk about this, so let's get into it. First one on the docket, systematic desensitization. This is using classical conditioning to train you to no longer have anxiety. So it's based on classical conditioning and uses 3 steps. Step 1, progressive relaxation. We're going to have to teach you relaxation techniques. Then we come up with an anxiety hierarchy, and then we combine the 2 together. So let's start at relaxation techniques. You've probably heard of these relaxation techniques. You probably have your own techniques in how to relax. Sometimes it's a drink, but what we want is something that's totally portable, totally legal, something you can use at any time. I'm stressed out, so I want to be able to use this. The most common relaxation technique, which you've probably heard of, breathing. Breathe in through your nose and out through your mouth. But control your breath. In through the nose and feel your lungs fill with the air and fill them up to their maximum capacity. Then, after you fill them up to the maximum capacity, you're going to be tempted to let the air out all at once. But don't. Let it out nice and slowly. Pause after you let out every single last bit of air from your lungs, after you feel your lungs deflate, and then inhale once again through your nose. Feel your lungs inflate once more, and you want to keep on doing this, and keep on expanding the amount of time that you spend inhaling and exhaling. The trick is you want to treat breathing as if it is a skill. If you just focus on your breathing regularly, your typical inhalation and exhalation is only about 15 seconds of that. 7 seconds of inhaling, 7 seconds of exhaling. But if you're really good at breathing techniques, you're going to notice you're going to be spending 30 seconds inhaling, 30 seconds exhaling, and even beyond that, maybe minutes of inhaling, minutes of exhaling, right? If you start doing it and you start to become out of breath, relax. Just start all over again. Start small. In, out, then out, then in, then out, and make it bigger and bigger and bigger. This is known as a relaxation technique of breathing. Treat it like a skill. Here's a little secret of it. The man behind the curtain. Because It is a skill that you can practice in private. A lot of people won't even notice that you're doing it, so you can even practice it in public. But the cool thing is, if you really are focusing on your breathing, you're not focusing on anything else. You're relaxing. You're so focused on what your lungs are doing and how you're breathing, you're not thinking about that scary spider. You're not thinking about that final exam that's coming up. You're not thinking about your crappy relationship. You're thinking about your breathing, and that's it. So once you're able to do this, then we have you make an anxiety hierarchy. But before we go on, let me tell you some other relaxation techniques. There's a muscle tension technique. The muscle tension technique is where you kind of flex, and then you let it go. Flex again, and you let it go. This one can be a little bit more visually noticeable. Someone could say, are you flexing? But it is a good one as well. It gives you something to focus on and gives you a little bit of a workout, a little bit of a burn. Right? There's also just imagination relaxation techniques. Imagine that you are in an exotic place, etc. But let's talk about the anxiety hierarchy. What we want to do is think about something that really makes you anxious. Maybe it's a phobia. So let's imagine an anxiety hierarchy for a phobia. I want you to imagine the most scary situation that you can think of using, let's suppose, spiders. You're scared of spiders. So what is a scary situation using spiders? Well, probably the scariest situation I can think of is I dig a vertical hole, deep hole in the ground in the middle of the forest that's about 7 feet deep, but not very wide. Then I'm going to stick you in this hole, and then I'm going to fill it to the brim with nothing but spiders. So you don't even have enough room to reach your hands up to your face, but you're deep in the ground. I'm just going to get a dump truck, beep, beep, and dump a whole bunch of spiders right in that hole. That's probably the scariest thing you can think of. But now think about the least scary thing, but still involves spiders. Probably just imagining a picture of a spider. Don't imagine a spider, imagine a picture of a spider. Still a little creepy. So we'll label that the hole in the forest filled with spiders as level 100. And imagining a picture of a spider at level 1. Then we're going to come up with all these scenarios between, going from level 1 to like level 2, level 5, level 50, etc. We're going to come up with as many as possible, and this is your anxiety hierarchy. The last step is we're going to combine these two. Starting at level 1, if you can imagine a picture of a spider and relax, then we're going to go to level 2. Then we're going to go to level 3. Let me give you another example. Here's one for a dentist. So you see level 10. Driving past the dentist's office on a Sunday afternoon. Why a Sunday afternoon? You know why. Because no one's in there. It's the beast lair, but that beast of a dentist isn't running his drill. The dentist isn't there. But once you can do that while relaxing, then we'll have you drive past the dentist's office on a work day. The beast is in there drilling away as we speak. But if you're able to do that and relax, we keep on going up the level until you can get to level 100. You hold your mouth open, eyes closed, listening to the sound of a dental drill as the cavity is repaired. If you're able to do that and relax, congratulations, you no longer have a fear of dentists. So you're in that hole with the spiders, breathing spiders crawling in and out of your nose and your mouth. And if you're totally relaxed while that's happening, hey, you don't have arachnophobia anymore. Again, what is this an example of? Systematic desensitization, one of the 3 forms of behavioral therapy I'm going to be teaching you. We're running out of time, so let's get to the other ones. The other is aversion therapy. This is classical conditioning. We're going to teach you to associate bad things with something we don't want you to do. For instance, there's aversion therapy for alcoholics. We can give you a drug that doesn't do anything unless it's combined with alcohol. If you take this pill, and then you drink some alcohol, it makes you violently ill. So eventually you're going to associate alcohol with immediately being violently ill. In reality, this therapy does not work. Why? Because people stop taking the pill. They think, all right, well, I like getting drunk, but I don't like getting sick, so I'm going to stop taking this pill that gets me sick. People aren't dumb. But here's an interesting question that we don't have time to get into. Think about this. Should we be allowed to force people to take this pill? It's very possible that we can do a pill implant that releases this chemical when someone drinks alcohol. So anytime they drink alcohol, they get sick, which would force them to never drink alcohol again. If they've killed enough people with vehicular manslaughter while driving while intoxicated, should we be able to do that? Or is that some type of freedom being lost there? Well, a conversation for another day, but that's aversion therapy. We combine the bad thing with a bad thing so you don't do it anymore. Last but not least is token economy. This is your Dave & Buster's. This is your Chuck E. Cheese. It's as simple as coming up with tokens, a generic type of currency you give people for good behavior. It's based on operant conditioning, and you're giving them positive reinforcement. So let's suppose you show me some good study notes. I give you a little token. You show me that you're respecting me in class, you're not making fun of me anymore, I'm going to give you another token. We use this in prisons and classrooms and even hospitals. Hey, you've been behaving pretty well. Here's a token. And what do you do with those tokens? You trade them in for some prizes. It's been successful with severely disturbed people, and it's also very successful in getting little brats to keep on playing video games at Chuck E. Cheese. Just one more game. I gotta get the teddy bear. Mom, give me more quarters. I need the teddy bear. Well, it also works in prisons. Hey, if you haven't shanked anyone in a while, here's some tokens. You can get some Reese's Peanut Butter Cups with those tokens. So behave, y'all, and you get the token. Yeah. Uh-oh. We are out of time here, so let's finish up this. Here's an interesting thing about token economy. If we stop giving the tokens, the behavior stops. So there are problems with token economy. The other thing is, it's really hard to implement the right type of currency. I once went to the Sylvan Learning Center. I wasn't a really good grade school student, so my parents took me to the Sylvan Learning Center, and they used token economy. If I showed them better grades, if I showed them good study habits, they'd give me some tickets that I could exchange for gifts. But I exchanged my tokens for itching powder, put it in some guy's gym shorts, and got suspended. So thank you, Sylvan Learning Center, for getting me suspended by giving me the gift of itching powder. Why would they have that as a gift? I don't know. But anyways, that's token economy. And I remember hard to implement the right type of economy for it, because when I'd go to Sylvan Learning Center, there was always the tutor that was like the token fairy. She's like, here everyone, have as many tickets as you want. Woo! We always wanted her because she just gave them away like they were nothing. But then there was the token Nazi who would never give us tokens even for the best behavior. It was really hard to earn tokens. So it's a hard system to implement. But it's harder yet that once you stop implementing it, they stop the behavior. Just like you'd stop mowing my lawn if I stopped paying you $20. When we come back in the next episode of Introductory Psychology with Professor Gerding, we're going to talk all about cognitive therapy. We're going to think the stink away. So enjoy yourself and tune in next time. Bum, bum, bum.